Hi everyone, Namaste and welcome to TimesHealth Plus. I am Dr. Sneha Rathi. I am a musculoskeletal physiotherapist and a certified yoga teacher from the Yoga Institute, Santa Cruz, Mumbai. I combine the techniques of yoga and physiotherapy and give my patients the best results from that. Today, we are going to talk about one of the most important joints of our body, which actually influences the other joints as well. Can you guess which joint I am talking about? If this joint gets affected, it can actually influence the other joints of the body as well. So just if you can guess which joint I am talking about, it would be great. You can type it in the comment box. Okay, Amit ji says shoulder, Radha ji says knees, Jagdeep ji says hip, Amit ji says hip, Shibani ji says neck, hip. Okay, we are yet not getting the right answer. So today we are going to talk about the spine. The spine is the one which actually connects our limbs. So it connects our limbs and it actually influences the movement of our limbs. So suppose if I am not able to raise my hand completely, there can be a component of the spine which may be affected, and that might cause the lacking of the movement of the arm. Similarly, if I am not able to lift my leg completely, it can be influenced due to the lower back or the lumbar spine. So that's how it is. The spine is so important that it can actually influence all the other joints of the body. Also, are you aware how many bones are there in our spine? Can you guess the number of bones in our spine? Radha ji says 118, okay. Amit ji says 120, okay, that's little higher. Jagdeep ji says 33, yes. Amit ji says 33, that's right, there are 33 bones in our spine. Our spine is actually, they have divided it into 5 parts, that is the cervical, the thoracic, the lumbar, the sacral and the coccygeal or the tailbone area. But in overall, the bones that are there in the spine are 33 small bones. Imagine the amount of control that is required when you are moving the spine. These 33 small bones, they are all moving together in a certain way to give you movement. Imagine how much amount of control must be required to control these 33 bones altogether when they are moving into different positions. So, can you understand what kind of muscle control is required when you are moving these 33 bones? They are also connected by ligaments which actually support the spine, but the amount of muscle control that is required while doing any kind of movement is very, very important whenever you are tackling any kind of spine condition. So, today we are going to understand what kind of muscle control is required while performing any asana that we are doing in yoga, and what are the technicalities of it. We are going to delve into a little bit of depth of that. I am going to teach you the asanas and I am going to teach you what are the technicalities of moving into the asanas and how you can protect and take care of your spine through these asanas. Now just first let's understand what are the right ways to sit, stand, from sitting position, stand up. Just let's understand a little bit about it. Okay, so I'm just going to show you. You have to guess the right position. Okay, so this is position number 1. This is position number 2. And this is position number 3. What do you think, which is the right position to sit? Position number 1, position number 2, and position number 3. Yes, so I can see majority of them. Mridula ji says 3, Shibani ji says 3, Amit ji says 2, Kunal ji says 3. Somebody also says, Akanksha ji says 2, Amit ji says 2, Manya ji says 1. Okay. So majority of you all are saying 3 as the right answer, and that is absolutely correct. In the position number 1, where I am sitting like this, I am actually not sitting on my sit bones, but I am sitting on my tailbone. And this can actually lead to lot of tailbone problems or coccydynia, what is called as tailbone pain. So this kind of position is actually the weight bearing is coming onto the tailbone and not on the sitting bones. The next position that I have shown you is a little arched back and sitting with a high arched back and trying to sit erect. Though it is an erect position, but it is constant strain on the extensor muscles of the spine. There is a lot of arch in the back, and that can eventually lead to fatigue of the back muscles, and that can lead to pain. So this was about position number 2. And position number 3 is a well supported back, wherein you are sitting on the sit bones and you are keeping your spine adequately straight, not excessively arched, but adequately straight. This is the correct way to sit. So the third position is the right position to sit, and you can always assume this position. But most of the times we end up sitting like this, and this actually can cause a lot of tightness in the lower back region as well as the hip and the leg regions. So this can lead to back pain eventually or tailbone pain eventually. So we should absolutely refrain from sitting in this kind of position. This kind of position is also attained when we are sitting on a sofa. So that also can actually cause a lot of back pain issues, and that's why it's better to have a little firmer sofa rather than a very soft sofa which sags you into it and actually causes this kind of positioning of the back. The next thing that I would like to discuss with you is how to transit from sit to stand. So let me show you 2 ways of doing this. One is this, and another one is this. So number 1, shifting the weight and then getting up, and number 2, getting up straight. So what happens in this is, let me tell you, whenever we are shifting the weight forward and we are trying to bend forward and get up, we need a good amount of back muscle strength to do this. This just indicates that our leg muscle strength is not enough to actually support us to push us up. So that's why we tend to bend forward and then lift yourself up. This kind of getting up is actually can cause lot of back pain and strain on the back. So it's very important that you strengthen your legs enough so that they are able to take the weight of your body and you can get up straight whenever you're getting up from the chair, rather than bending forward and then getting up like that. Okay, so this is a good way to get up, wherein you are taking all your weight on your legs and your feet, and then you are getting up with your back little straighter. Next that I would like to explain is how do we lift things. That is very, very important. Okay, can you explain the position 2 better? Alright, I can explain it a little better. So in the position 1, I was leaning forward and then getting up. Okay, so that leaning forward and getting up causes a lot of strain on the lower back. you can manage with that, but you need good strength in the lower back muscles in order to do this. But in the second position, I'm using my legs enough, and then I'm keeping my back a little straighter and then getting up straight from the chair. So here there is no strain on the lower back, which was happening in the first position. So that's why it's absolutely straight, and it's more of usage of the legs which is happening. So this is what is happening in the position 2, and which is why it is a better way to get up as compared to the position 1, where we were bending forward and then getting up. Alright, so thank you. Now the next one that we are going to do is lifting of any object. So I'm going to lift the object 3 ways. You're going to tell me which is the correct way to do it. So lifting 1, lifting 2, and lifting 3. So what do you think? What is the right way to lift any object? Manya ji says 3. Shibani ji says 3. Mridula ji 3. Jagdeep ji 3. Chandana ji 3. Okay. So everybody says 3. Now, yes, that's the right answer. So over here, when we are bending forward and lifting any object over here like this, there is a lot of strain on the lower back, that is for sure. And this is the commonest position wherein you develop slip disc or any back related strain, because you are trying to lift the entire weight with the help of your back muscles. And if you don't have enough control of your back muscles, definitely there will be something amiss and there will be a strain in the lower back. So that's one thing. The next one was wherein I was actually bending sideways and lifting it up. Again, there is an unequal balance in the lower back in this case. So you need a good strength of the opposite hip muscles in order to do this. So it's very important that an unequal balance in the lower back is not done, and this kind of lifting is not encouraged, because again this can lead to strain in the opposite side of the lower back. Whereas in this, the load was equally distributed in the knees and the lower back, and I was bending and lifting an object like this. So this is equal distribution of the weight in the back as well as the back as well as the legs, and that's why this is a better way to lift any object. In this position also, you need a good flexibility of the legs. If you don't have a good flexibility of the legs, you might end up injuring the lower back, which is why the first position is not correct way to lift. Neither is the second position, because of the unequal balance that is there in the body. And the third position is definitely a better way to lift any object with both the hands equally distributed. The object weight is equally distributed in both the hands, and you are using your legs as well as your spine equally to lift any object. So the load is distributed between the two joints. Alright, so this is the right way of doing things. Now let's understand, once we have understood these transitions, now let's understand which asanas are going to be really beneficial to help the spine. Jagdeep ji asks, what about distance between the legs? So the distance between the legs can be about 2 feet distance. That is a good distance, or a hip width distance. That is a good distance to actually bend and lift any object. Okay, not too narrow, not too wide. A hip width distance is a good distance. Alright, so now next what we are going to understand is the technicalities of some asanas that we are going to do, and we are going to understand how to perform those asanas and what are the benefits as well as the disadvantages of certain asanas. Okay, so let's start. You can all get your mats and we can all start together performing the asanas. So we will keep our legs together and we will start with Sthit Pratnasana, that is conditioning. We do it every time. So just to get all our attention towards our body and to understand what exactly is happening in our body when we are performing these asanas. So stand with your feet together or slightly apart is also fine if you are unable to balance. Look at one point in front of you. Now join your hands in front of your chest. And slowly close your eyes. If you are unable to balance, you can keep your eyes open. Pay attention to your breathing as well as your body. Now slowly relax your hands and open your eyes. Take 1 foot distance between your feet and we will start with a little bit of warm up so that our muscles get ready to do the stretches that are needed for the lower back and the spine muscles. So we will start with the neck first. Take your neck up and down. 1, 2, 3, 4 and 5. Now the next one is we are going to turn our head to either sides. 1, 2, 3, 4, 5. Now we are going to drop our ear to the shoulder. 1, 2, 3, 4 and 5. The next we are going to do is rotate our shoulders. So just turn it behind. 1, 2, 3, 4, 5. Now turn it from back to front. 1, 2, 3, 4, 5. Now we are going to just bring our hands at shoulder level, fist it and just rotate our wrist. 1, 2, 3, 4, 5. Turn it the other way. 1, 2, 3, 4, 5. Now just interlock your hands and slowly turn either sides. 1, 2, 3, 4 and 5. Perfect. Now we are going to raise our hips up. So keep your hands at the elbows bent at 90 degrees and 1, 2, 3, 4, 5. Now we are going to turn our ankles. So keep your hands at your waist and slowly rotate your ankle clockwise. 1, 2, 3, 4, 5. We can do it on the other ankle. 1, 2, 3, 4, 5. Okay. So this was about the warm up, a short warm up that we have done. Now we are going to get into some asanas that is really going to help, with the health of the spine. And what is the importance of each of the asanas, I am going to explain that to you. But before that, let's understand what are the movements that are happening at the spine. So our spine is capable of bending forward, bending backwards, bending sideways, rotating or twisting, and elongating as well as compressing. Okay, so we have these many movements at the spine, and we need to maintain each of the movement in our day-to-day life in order to keep the spine health good, in a good state. So it's very important that we perform all of these motions every day, on an everyday basis, so that our spine health is in a good shape. So that's the thing that I would like to say. So let's start with elongation first. Why elongation is important? Because throughout the day we are under the pressure of gravity. So gravity is constantly pulling us down. It causes a lot of compression at the spinal level. So an elongation might really help you to relieve that compression and have a good lengthened spine and erect spine. So for that, the first asana that we are going to do is Talasana, Talasana 2. So take a 1 foot distance. Keep your hands by the side. Now slowly you have to come up on your toes, raise your heels up and raise your hands up. Stretch yourself up towards the ceiling. Slowly turn your hands and bring them down. Now we are going to do this with counts and breathing. So let's start. Inhale, 1, 2, 3. Stretch yourself up. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. We will do it again. Inhale. 1, 2, 3. Use your hands to stretch your spine up. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. The rhythm, that is how you get into the pose and how you get out of the pose, is equally and very, very important whenever you are doing any kind of yoga asana. So make sure that that is very rhythmic with counts and with breathing. We will do it once again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. So this was Talasana 2. Next, let's go on to Trikonasana. Trikonasana 2. So here we are going to take about 3.5 foot distance. This is a side bending pose wherein we are going to bend sideways. Now what happens with standing asanas is that when we are moving towards gravity, there is a lot of control that is exerted by the muscles. Okay, so they are very important asanas to develop a good control of the spine whenever you are moving towards gravity. Let me show that to you. So we are going to turn 1 foot outside, take our hands to the shoulder level. Slowly we are going to bend sideways from the waist as far as we can go and turn our head to look on the upper hand, if that is possible. If that is not possible, you can keep looking in front of you. And slowly come back to the starting position. So here, when I am actually bending sideways, there is a lot of control that is exerted from these muscles here, over here, and there is a stretch also happening in the leg. So let's start. Take your hands up. Inhale, 1, 2, 3. Exhaling, bend sideways, 1, 2, 3. Stay there with normal breathing, 2, 3, 4, 5, 6. Inhale, come back, 1, 2, 3. Exhale, 1, 2, 3. And turn the foot back into position. We're going to turn the left leg outside. Take our hands up. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Turn the foot back in. We will repeat it again on the other side. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. It's very important that you don't force yourself to go down till the ground. It's okay to bend even slightly, but make sure that you're not bending forwards or you're not bending backwards. It's always on the side. Okay, so turn your left foot outside. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. So the way you are going and the way you are coming back is very, very important. Make sure you focus on that as well along with the pose that you are doing. Okay. The next asana that we are going to do is a rotation asana. Whenever we are doing any asanas in standing, our leg control is also equally important. Okay, so make sure that your legs are firm on the ground when you are performing any of these asanas. So we are going to do Konasana 3. Here we are going to take about 2.5 foot distance. Okay, now over here how we are going to do is take your hands in front. Slowly bring your hands to the side. Now twist yourself and try to touch the opposite toe and turn your head upwards. Slowly come back to the starting position. Repeat it on the other side. And come back to the starting position. It's very important that if you have any of the conditions like slip disc or hernia, or you are suffering from any spine surgeries you have done recently, then make sure you do not do any of these asanas, okay, as they can be detrimental to your spine health. So let's start with Konasana 3. We are going to take our hands up. Inhaling, take your hands out. 1, 2, 3. Exhale, bend forward and twist. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale, come back. 1, 2, 3. Exhale. 1, 2, 3. Alright. Here we are not going to shift our waist. Okay. That's very, very important. Okay. You have to keep it in the center. Now again we are going to keep our hands in front. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. So you see the rhythm with which we are going and the rhythm with which we are coming back. That rhythm is equally important. Okay, I am going to stress on that rhythm again and again. We will repeat this one last time. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, go other side, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Alright, so this is Konasana 3. This was kind of a rotation or a twist that was happening. Now we are going to go to forward flexion or bending forward, but you have to be very careful with this, as the control of the muscles is very, very important whenever you are bending forward. Okay, so we are going to do Hastpadasana. Now here the control of the back muscles is very, very important whenever you are doing Hastpadasana. Also the leg muscle control, that is the glutes and the hamstrings, is very, very important whenever you are performing this asana. Now over here what we are going to do is, we are going to take our hands to the ear level and slowly elongate our spine and bend forward as much as you can. If you can touch the floor, good. If you can take your hands behind your calves, good. If not, you can just stay where you are. Stay there. Now bring your hands to your ear level and slowly come back to the starting position. So while coming back, the rhythm is equally important, how we are going down and how we are coming back. Okay, so let's start. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Okay, so make sure you are coordinating your hands, spine, legs very nicely in a coordinated manner. Okay, so we will do it once again. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Another asana that is a forward bending asana which is equally helpful is Trikonasana. So Trikonasana 1. So we are just going to do that, and I am going to show you one variation or one more asana that is going to be really beneficial for the back strength, overall strength. So Trikonasana 1 is, we take our hands up, we had done this last time as well, bend forward, keep our back straight and neck straight, come back to the starting position and relax. Okay, so we are going to do this again. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Why I am showing you these two variations is, in one variation we are actually bending the back, and in the other variation we are hip hinging. We are hinging at the hip, and we need to understand this very clearly whenever we are trying to understand the spine. Okay, so we will do it again. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Normal breathing, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. So this was forward bending. One asana that can be actually very helpful in strengthening the back in this position is, you keep your hands up and then bend forward 90 degrees. This is Samkonasana, and then come back. But perform this asana only if you are confident enough to handle so much of weight of the arms that is adding on to do this kind of asana. Okay, so let's do this. Inhale 1, 2, 3. Exhale 1, 2, 3. Stay there 2, 3, 4, 5, 6. Inhale 1, 2, 3. Exhale 1, 2, 3. So Samkonasana can be performed if you are confident enough of the strength of your legs and the lower back as well. Alright, so this is about the forward bending. We are going to do one backward bending asana wherein we are going to keep again a distance of about 1 foot, and we are going to just keep our hands at the hip level and bend backwards. This is a Sahaj Bhav asana for the hip. So inhale and come back. Over here the control is coming from the abdominal area. Okay, so make sure that you are going slowly behind and you are not pushing the hips forward or locking the spine, but the control is coming from the abdominal area. So we will do this. Inhale 1, 2, 3. Stay there 2, 3, 4, 5, 6. Exhale 1, 2, 3. If your abdominal control is not that great, then you might get some pain in the back. So make sure that you are first developing the abdominal control. We will repeat this again. Inhale 1, 2, 3. Stay 2, 3, 4, 5, 6. Exhale 1, 2, 3. So these are some simple asanas that you can do on a daily basis if you have good strong legs and you are able to control the movements while you are performing these asanas. If not, then we have some alternatives like in sitting and lying down, which I am going to show you now. So what should be the minimum time between yoga and food consumption? At least of 3 hours. There should be a gap of 3 hours between food consumption and yoga, so that the digestion has happened and now the blood circulation can be directed towards your muscles. So now we are going to sit and we are going to perform some asanas. So in standing we did elongation, we did twisting, we did side bending, we did forward flexion, and we did backward bending. Now we are going to do sitting. So in sitting, first we are going to perform elongation. Elongation is a very important aspect of spine health. So let's perform that. That is Parvatasana. So keep your hands by the side. Inhaling, take your hands up. 1, 2, 3. Stretch your hands up so that you can elongate your spine. 2, 3, 4, 5, 6. Exhale, bring your hands down. 1, 2, 3. Very simple but very effective. So you can perform this asana every day. This is going to correct the posture as well as help in spine elongation. You can take a Padmasana position also in this if it's possible. If it's not possible, just sit in Sukhasana and you can do this asana. You can also do this asana sitting on a chair. So it's not essential that you sit on the ground and perform these asanas. So take your hands by the side. Inhale. 1, 2, 3. Stretch up. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. We will repeat it once again. Inhale. 1, 2, 3. Stay. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. So this was an elongation pose in sitting. We can do a side bending as well in Parvatasana itself. So you take your hands up and slowly bend sideways. Come back to the center, bend to the other side, come back to the center and relax. Okay, so let's perform this once. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Now inhaling, bend sideways, 1, 2, 3. Normal breathing, 2, 3, 4, 5, 6. Inhale, come back, 1, 2, 3. Exhale, 1, 2, 3. We are going to do it on the other side now. Inhale, 1, 2, 3. Exhale over here, 1, 2, 3. Inhale, bend sideways, 1, 2, 3. Normal breathing, 2, 3, 4, 5, 6. Inhale, come back, 1, 2, 3. Exhale, 1, 2, 3. So this was a side bending asana which you can perform in sitting position. This is again going to strengthen your side muscles, and lot of control is required to bring your body towards gravity, and the control is brought about by these side muscles, okay, when you are performing this asana. Now next we are going to go for a rotation asana. So you keep your legs straight. It's important to learn to sit straight in this position. Okay, so this is a dandasana position wherein you are sitting on your sit bones and you are trying to sit up straight. So it's important for a good spine health and flexibility to have been able to do this position. So here we are going to do sitting vakrasana, wherein we are going to raise our hands up, twist, come back to the center, twist to the other side, come back to the center and relax. This twisting cannot be done in this position. So if you are unable to straighten up, then practice straightening up first and then go for a twisting asana. So sit up straight. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Inhale, 1, 2, 3. Exhale, 1, 2, 3. We are going to repeat this again. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Inhale, 1, 2, 3. Exhale, 1, 2, 3. This gives a good twist to the abdomen as well as to the spine, and a good control of leg muscles as well as your spine muscles to move in a coordinated manner. So it's a very efficient asana if you want to train your spine to move in a coordinated manner. Okay, next. So these are few asanas that can be done in sitting position. Next we are going to do some asanas in lying down position that are going to be effective for spine. So how to make the back straight? You can first try and take support of the wall and sit with your back against the wall. So you can try sitting like that with the back against the wall. Try stretching your hands up against the wall and try to elongate your spine. Maintain this position first with the wall support, then come slightly away from the wall and then try to stretch without the wall support. So you can always practice this. This is going to help you make your back straight. Now let's lie down and see some asanas which are going to be effective for the spine. So we turn on our side, always lie down by turning on your side and then on your back. First is Yastika asana. So we are going to do the elongation asana first. Inhaling, take your hands up and stretch your feet down. So those of you who cannot do the standing and sitting asanas can attempt this and then come back and relax. So as if you are pulling the legs downwards and stretching the hands upwards and elongating your spine. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. This is very safe and can be effectively done. Okay, so please practice this Yashtik Asana on a regular basis. Next, we are going to go for Pavan Muktasana. So in Pavan Muktasana is nothing but flexion of the spine. So here what we are going to do is inhaling, exhale and bend your knee and bring it towards your abdomen. As much as you can, stay there. 2, 3, 4, 5, 6, slowly down. 1, 2, 3. Repeat it on the other side. Inhale, exhaling. 1, 2, 3. Normal breathing. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. So we are going to repeat this again. Inhale, exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. So this was Pavan Muktasana. Next we are going to go on our abdomen and perform what is called as Shalabhasana. So keep your chin on the ground. Keep your hands by the side and slowly raise your leg up one at a time with the knee straight. Slowly relax. Repeat it on the other side. And slowly relax. Your very important thing is when you are raising the leg up, you are not trying to arch the back and then trying to raise the leg up. You are trying to use your glute muscles, your hamstrings and your leg muscles to raise the leg up. So let's start. Inhale, exhaling, lift. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Again. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. We will repeat this again. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Repeat. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. So this is Shalabhasana. Now next we are going to do Bhujangasana, which is again back extension, which we have already done before. So keep your hands by the side, keep your forehead on the ground, legs together. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. We will repeat this again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. So this was Bhujangasana. This is also very effective in actually helping your spine health, because it is an extension pose and very beneficial mostly for the cases like slip disc. It is going to be really helpful. Now I will just tell you one small thing, that is finding the neutral position of the spine. So what we are going to do is we are going to go in quadruped position. So from Vajrasana, you can just keep your hands like that, elbows touching your knees, hands like that, and take one hand forward from the point where your hand was resting. Now we are going to arch our back like this, and we are going to flatten our back like this. Okay, this is like the cat cow pose, Marjari Asana, arch our back, and Bithilasana, curve our back, and now try to find a neutral position, that is a midpoint between these two, and hold the spine in that position. Stay there. 1, 2, 3, 4, 5, 6, and relax. Okay, try to do this once again. Go into Marjari Asana, arch your back, Bithilasana, curve your spine, and now slowly try to find a midpoint and stay there. 1, 2, 3, 4, 5, 6. So this is the neutral position of your spine, not too much arched, not too much flat, but in the mid position. So make sure that you are trying to find the mid position of the spine by doing this asana. So let's go on to one breathing exercise in sitting so that we can relax ourselves. Since my knees are replaced, is it okay to do this asana? You can go on your knees with a knee pad under your knees, that is fine. You can keep a rolled towel below your knees and then go into this position, that is absolutely okay. Okay, so now we will just breathe. Keep your hand on the abdomen. Inhale. 1, 2, 3. Exhale. 1, 2, 3. 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 And relax, normal breathing. Slowly rub your palms. Cup your eyes gently. And slowly open your eyes and relax your hands. Okay, so these were some of the asanas that can be practiced for good health of the spine. If you are suffering from any kind of condition, then specific asanas need to be avoided, and you need to be sure of the muscle control that you have while performing these asanas. So make sure that you perform these asanas. If there are any questions, I can answer. What is the advantage of finding the neutral position of a spine? So that's a very nice question, Jagdeep ji. So it's very important that when we are standing or sitting or in any kind of position, we are not too much arched or too much flat. So if you are on a regular basis aware of what is the neutral position of the spine, then you can maintain that position while you are in different positions, right? Because too much arching of the spine can actually cause a lot of strain on the extensor muscles or the back muscles, and too much flattening of the spine can actually cause a lot of strain on the discs of the spine. So finding a neutral position will be really helpful for making you aware, okay, what is the correct position, whether I am holding it in the right position or no. So practice this asana regularly, quadruped pose that I showed you regularly, and you will be able to actually create that awareness in your body that what is the neutral position. Are there any asanas to be avoided in cervical spondylitis and varicose veins, I think? Yeah, okay. So cervical spondylitis, generally the forward flexion might be a little strenuous for you, so that should be avoided. Okay, you can do the other exercises that were shown. And varicose veins, so you can easily do these poses. A forward bending or stretching of too much of the leg muscles I would not recommend. It would be better to strengthen those muscles instead of stretching the leg muscles. So too much of forward bending I would not recommend, wherein there is a lot of stretch in the legs. So that's what I would like to tell you. So I have a challenge for you. That is what we practiced today. You're going to find the neutral position of the spine just like we did today. Click a picture of it and upload it on Instagram and tag TimesHealth Plus. Also do follow TimesHealth Plus on all the social media pages like YouTube and Instagram. Please follow it, and I hope today's session has given you some insight on how spine health can be maintained on a regular basis by practicing the various asanas. Also told you the technicalities of the asana. So you're going to keep that control, muscle control in your mind while performing the asanas. Also osteoarthritis, you should avoid any asanas. Yes, you should avoid sitting on the ground with legs folded like this. So avoid this kind of asana when you are having osteoarthritis. Alright, so next time we are going to also work on our hips and our knees, which are going to support our spine as well. So hip opening asanas are very important for spine health. So we are going to cover that next time. So I hope to see you next time. Till then, stay present, move gently, and make sure that you take care of yourself. Thank you. Namaste.